Good evening. My name is Dr. Sanjay Daluvoy. I'm a board-certified plastic surgeon at Specialist in Plastic Surgery. Today was a productive day for the team and myself. We saw two facelift consults and saw three post-op facelifts. And one of the things that's come to my attention in doing a lot of facelift surgery is there's some common questions that come out there, as well as some common misconceptions. I think the first is where the incision is placed. And there is no invisible scar in surgery or facelift surgery, but there are well-hidden scars based on location, your technique, and then post-op scar management. And for most facelifts, especially the ones that I do, the incision is periauricular, and all that means is around the ear with extensions into the hair, around the ear in the front, to the back, and then down the scalp. And post-op management of this is involving scar gels or lasers is really an important adjuvant therapy. The other question is the plane. Do you do deep plane, SMAS Plication, or just skin only? I'll tell you in general, skin only is a very poor surgery. It's not a very good, high quality surgery. I definitely recommend doing something with the deeper layer involving the SMAS. Deep plane just means going below the SMAS and pulling it nice and tight. SMAS plication means pulling the SMAS over itself and getting it tight. In general, we are finding better results with deep plane, but both can be good depending on the patient's anatomy. The third thing is, am I the right candidate? And is there a certain age? There is no magic to that. That's a personal choice, but it's also based on your physical characteristics. If you start seeing skin laxity in your neck, marionette lines down your on the corners of your mouth or jowls, then you start becoming a candidate for facial rejuvenation. It can start with little things like skin care, laser treatments, neurotoxins, or fillers, but then once it gets beyond a certain level, facelift surgery becomes very important. And so anytime a patient comes in, I don't have a formula and apply the same thing to all my patients. And I listen to the patient's goals and then apply based on their anatomy, what is the right surgical technique in terms of incision placement and what's the right plane. And that's how I really push towards giving patients a very natural look and not the pulled over tight look. So looking forward to seeing you during a consultation if you're interested. Have a great day.